ordering?
I got my assistant a $25 gift card from the chocolate place. Ordered the Monco Small Business.
I just hope they're there when they. I just hope she can use it when they open. I said I hope that they reopen.
They do. They can.
Oh, okay.
They can ship it. So sweet apple.
Sorry, just me again. Just me again.
Good afternoon, everybody. Today is Wednesday, April the 22nd. I am Dr. Val Arkosh, Chair of Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Vice Chair, Commissioner Ken Lawrence, and Commissioner Joe Gale, Dr. Al Wong, Regional EMS Director, and Dr. Brenda Weiss, Administrator for our Office of Public Health. Since our April 21st press briefing, we have had 106 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 3,093. These positive individuals are from 38 municipalities, none of which are reporting new cases. This keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. Today's individuals range in age from 9 months to 100 years old. As always, you can check the county map after this briefing at montcopa.org/COVID-19 for an updated geographic listing. Today we have 2 children between the ages of 0 and 9, 8 between 10 and 19, 5 individuals between 20 and 29, 19 individuals between 30 and 39, 14 individuals between 40 and 49, 24 between 50 and 59, 13 between 60 and 69, 7 between 70 and 79, 8 between 80 and 89, 5 between 90 and 99, and 1 between 100 and 109. We have 52 females and 53 males. 5 were hospitalized at the time of their death, 2 were not, and the remainder we don't have information on. I am also today saddened to confirm that 2 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 174 deaths confirmed positive from COVID-19. Both of those individuals passed away in a hospital. They ranged in age from 61 to 75. In total, we now have 86 female and 88 male deaths overall. 10 have self-identified as Asian, 2 as Asian Indian, 3 as Asian Korean, 19 as African American or Black, 66 as white, and 74 as unknown. Now, I'm going to introduce some new information today and some new words, so bear with me. We may adjust this if this doesn't make sense. But up until today, we've been reporting in terms of deaths the individuals that were confirmed positive for COVID-19, meaning that they had a lab test that was positive for COVID-19. In addition to that, our coroner receives information through death certificates that the individuals or the medical personnel caring for an individual believed they died of COVID-19 and put that on the death certificate, for instance, but we do not have a lab test. Either the facility wasn't able to do it or maybe the person passed away at home, but we do not and will not have a lab test for that individual. So we are going to call these probable COVID-19 deaths. So I'm going to recap here. We have 100 today. We have a total of 174 deaths confirmed positive. We have an additional 77 individuals that have been considered probable deaths. So that brings us to a total of 251. Our hospital beds continue to do well. All of our hospitals do have space. 1 or 2 are starting to get a little bit of an increase in their occupancy, starting to get close to being full, but so far we are okay, which is my daily reminder to thank you for staying home and to urge you to continue to stay home as we work to protect our hospitals. We are clearly not out of the woods yet. Today we have 85 facilities that are reporting positive cases of COVID-19 among their staff and their residents. These total 790 cases among residents, 383 cases among staff, for a total of 1,173 positive individuals. A reminder that these are not all Montgomery County residents, so those numbers I just gave you do not roll up and tie to our county totals. But we track these numbers and we share them with you as a snapshot of the very serious situation that many of our county long-term care facility and other congregate care settings are experiencing. We now have 101 confirmed positive deaths of Montgomery County residents. So 101 individuals with positive tests for COVID-19 that have passed away and were long-term care or congregate care facility residents. In addition, we have 55 probable deaths of Montgomery County residents who were long-term care or congregate care facility residents. So that brings us in total 156 long-term care out of 251 total. So we remain running about 62% of our total deaths here in the county from individuals who were in some kind of long-term care facility setting. We continue to have daily outreach and communication with these facilities. We do continue to assist with some PPE requests. Today we made in the process of making 4 visits. We have 2 teams of 2 individuals. Each of those teams is visiting 2 long-term care facilities today in order to help to assess what's going on within the facilities, to review procedures, guidelines for care of COVID-19 patients, infection control procedures, that type of thing, and to see if we can offer any assistance to these facilities. We have been in communication with the Pennsylvania Department of Health, who licenses most of these facilities, and have been communicating to them the serious situation that exists in some of these facilities. Today's update from the correctional facility, we did learn this morning of an additional inmate at the Montgomery County Correctional Facility that has tested positive for COVID-19. This brings our correctional facility to 6 inmates who have tested positive for COVID-19, and we do have 1 individual from whom we're waiting a test result. 2 of the 6 positive inmates have recovered. The 4 active patients, 2 of the 6 have recovered, and the 4 active patients remain in isolation and are currently stable. As a result of potential exposure, 198 individuals are in quarantine. They are all asymptomatic. As of today, we have a total of 6 correctional officers that have tested positive for COVID-19. 3 are recovered, and 3 are in isolation at home. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 959 today, a net decrease of 383 individuals, which is a 28% decrease. I have an updated number today that since March the 12th, there have been 602 discharges. The average number of daily commits is running about 6 per day, compared with 28 per day prior to March 12th. And our total commits as of yesterday are 255. So that just gives you a sense of the situation there. Very happy to report that our Montgomery County Community College drive-through site is open and running smoothly today. We have much more cooperative weather today. I want to just thank the Community College, Whitpain Township Police Department, the National Guard, and the several county departments that are assisting at the site. As of April the 19th, we have tested 932 individuals, and we have received results on 810 of them, which represents 87% of the total. 119 of those individuals are positive. So for those first several days, we are running 14.6% positive. That's compared to about 16% positive in the final days of our site at Temple Ambler, and compared to our peak couple of days where we were running 24% of the individuals tested coming back positive. The appointments for tomorrow, Thursday, will open at 8 a.m. tomorrow morning. Appointments can be made at montcopa.org/COVID-19 under the green County Testing Information button, or by calling 610-631-3000. So a couple of just kind of a little bit different and fun things today. Today is the 50th anniversary of Earth Day. And I just wanted to highlight there have been some bright spots from this pandemic, not many, but one of them is a great reduction in air pollution, particularly in nitrogen dioxide. So if you look at this map to my left, to your right, you can see that illustrated. This map shows NASA satellite data of nitrogen dioxide levels from the Aura Ozone Monitoring Instrument over the Northeast United States in March. And it's comparing the data from this March to the mean of the period from 2015 to 2019. And you can see that the data indicate that the nitrogen dioxide levels in March 2020 are about 30% lower on average across our region along the I-95 corridor from Washington, D.C. to Boston than when compared to the mean of 2015 to 2019. So you can just see a lot of that really dark color is gone, and the whole area is much less impacted than we used to be. So maybe not the most important thing, but a pretty important thing, particularly as we celebrate this Earth Day, to know that this extremely toxic air pollutant has gone down considerably. Nitrogen dioxide is primarily emitted from burning fossil fuels like diesel and gasoline and coal, and certainly anyone with a regular gasoline engine car has that coming out of their tailpipes. So this decrease in nitrogen dioxide is an indicator of changes in human activity, which we know have certainly happened over the last 7 weeks. And we appreciate that they've happened. It's been critical that they've happened. And then I just want to give a special shout out to Upper Dublin from our last testing site, and the Montgomery County Community College in Whitpain Township from our current site. And on this side, on this screen, you're seeing a PowerPoint presentation of a number of just beautiful homemade signs. It's alternating between the Upper Dublin site and the Community College site that were placed there spontaneously by neighbors and residents. I want to give a special shout out to a 12-year-old Whitpain resident who is the daughter of Pastor Brady Renix, who runs the Crusade for Christ faith-based group at the community college and organized the creation of many of these wonderful posters. Her poster, which will probably come up here in the rotation, was actually used today by the National Guard for the cover of their daily situational report. They were so touched and so thrilled to see these messages of support for their very hard work. You know, obviously all these folks are away from their family here helping the community here in Montgomery County, and it really made their day to come to work today and see all these posters. So thank you all for doing this work. Thank you to the Renix family for helping to organize this. And thank you so much to all the neighbors and the community college for making this incredibly wonderful group of National Guard workers feel welcome here in our Montgomery County community. And with that, I will turn over to Commissioner Lawrence.
Good afternoon. I'd like to share some information from the Commonwealth of Pennsylvania today. On April 20th, the governor signed Senate Bill 841 that approves notaries to perform online notarizations, which allows auto dealerships to conduct limited car sales and leasing operations through online sales. Auto dealerships may continue to remain open for certain activities, such as repairs and the sale of auto parts. The governor also announced that residential and non-residential construction may resume statewide with safety limitations starting Friday, May 8th. And construction projects will have to follow the guidance issued by the Commonwealth. Also from the state, the Pennsylvania Liquor Control Board has begun accepting orders by phone for curbside pickups at 176 locations. Phone orders can be placed from 9 a.m. to 1 p.m. or until reaching a store's maximum order capacity each day. Pickups must be scheduled from 9 a.m. to 6 p.m. within a few days of the order placement. There's a limit of 6 bottles per order, and only credit cards are accepted for payment, and as always, identification is required. So if you want to find out which stores are participating, you can visit www.finewineandgoodspirits.com. And to continue with the lighter theme as well, but also important, today is Administrative Professionals Day, when we celebrate the professionals who keep offices and operations running smoothly each and every day. So especially during the COVID-19 crisis, we want to thank all those who are working remotely on modified shifts or have been reassigned to help support our regional healthcare network and to make sure we can continue to deliver critical county services. Office support and data entry personnel in the healthcare system and in county administration offices, the mailroom services, people answering our public inquiry lines, people who are answering the COVID-19 line. They're all vital to help us keep managing the county, meet community needs, and collect necessary data. So we want to thank you all for your service wherever you are. And I want to give a special shout out to Regina Smith, my assistant, who I haven't seen for like a week and a half now, but I text her quite frequently, so I appreciate her still responding. And with that, I'll turn it over to Commissioner Joe Gale.
Hello, everyone. I'm Montgomery County Commissioner Joe Gale. A couple weeks ago, I warned the public of a new fraud and scam tactics that are unfortunately being used during the COVID-19 crisis. We are seeing these scams being perpetrated at an unprecedented level and in a diverse variety of ways. The goal is to trick the public into disclosing their personal financial information. The IRS had reported seeing a surge of phishing scams that target people expecting the economic impact payment from the federal government. Additionally, the Pennsylvania Department of Community and Economic Development has recently warned businesses of new potential scams related to the disbursement of small business administration loans. The Department of Community and Economic Development has received reports of small businesses being contacted by scam artists posing as loan agents asking for payments to apply for a loan, when in reality the Small Business Administration does not charge a fee to apply for a loan. We want to remind everyone to be extra diligent when making payments related to small business loans, and do not provide your direct deposit or other banking information to anyone who contacts you on the phone, through email, text messages, or social media unless you initiated the communication and you know whom you are speaking with. At the national level, the United States Attorney General Bill Barr's office has directed federal law enforcement to prioritize the detection, investigation, and prosecution of all criminal conduct seeking to exploit people's fears during the pandemic. The United States Secret Service and the FBI are working together with the Department of Justice to take down these con artists. However, please use your own vigilance to protect yourself as well. If you have received an unsolicited email or phone call asking for your personal or financial information, the safest response is to delete the email or hang up the phone. That's my update for today, and I'll turn it back to Commissioner Arkush.
Thank you. All right, happy to take questions.
I just want to clarify, 2 deaths or 5 deaths? Because when you're running down the total, you said 5 people lost their lives in the hospital. So I want to
Oh, I'm sorry. It's 2 deaths.
Okay.
And both of those deaths were in the hospital. I might have misspoken, but both. What I meant to say was both of those deaths were in a hospital. Yeah.
Any significance to the low number of deaths?
No.
Good news?
No. I mean, it's good news, right? But as we said before, one day does not a trend make. Yeah. So if we see this for 2 weeks, then we'll be really happy.
In
Yeah.
some other counties, coroners have reported concerns about the way that the state is reporting the number of deaths from COVID-19. That's including probable deaths. Do you share the concerns here, or do you want to? I know that you've said that you're now going to start bringing this that in, but
So I wouldn't call it a concern. I think we've been made every effort to be as. Oh, so in case everyone couldn't hear, sorry about that. The question was that there's been some concern expressed between coroners and the state, not our coroner, by the way, on how the state is recording and presenting deaths. And I believe the state has been reporting probable deaths. I think. Not actually 100% sure what the state's been doing. So regardless, in an effort to be as transparent and share with you what we have as much as possible, we've been actually working for the past several days to get 2 lists together. The one that we share with you every day, which is our case-proven, our lab-proven COVID-19 deaths, that individual who is now deceased had a lab test that was positive for COVID-19. And then what we've been working on and gathering together is a good system to make sure that we get all of those what's called probable deaths. So the people that didn't have a lab test, but whoever signed the death certificate thought that the clinical situation was close enough to COVID-19 that they said it was COVID-19. So we're going to report them separately because I think it's really important for a lot of science and epidemiological reasons that we know clearly how many people were proven to die of COVID-19, proven, and then but we will now, starting with today, also report the probables.
so our total since the first cases were discovered on March 7th in Montgomery County are 3,093. But to be clear, that's not 3,093 today have the virus. We still don't know how many people have recovered.
Right. So the question is, of the 3,093 total positives that we have here in Montgomery County, does that mean that 3,093 people are still sick? Absolutely not. Presumably, some number of them have recovered. We don't have any way to know what that number is, unfortunately. We do know that there have been 174 individuals who've definitely lost their lives to COVID-19, and that the remainder are in, some are hospitalized, in fact, quite a few are hospitalized, and some have recovered. I think probably at this point quite a few have recovered, but we just don't know what that number is.
Is there a way or a time when you might try to backtrack and figure out how long it took for people to recover? And you have the bulk of information from the testing. Obviously, people who haven't been tested, it's probable if they're staying at home, we won't know. But in terms of the data that you've gotten so far, would this be something that you would want to backtrack to figure out so that we know how many people, if it was 5 days, how many people it was 12 days?
Yeah. So the question is, will we at some point try to go back and find out from those individuals how long it took them to recover, or sort of what their course was? You know, I think all of us that care about public health and the science of this disease would love to know that data. And at some point, maybe if things calm down, it would be something we could contemplate. We don't have plans to do that right now. There's no way we could do that right now. We still have too many new positives every single day and all the work that goes with that. But it would be a wonderful question to answer. It could be a grad student's research project. I mean, there are many ways that we could go at that to try to get that information at some point.
I just had a quick question, too. In regards, is there any talk of having the National Guard coming to any of the facilities in Montgomery County. They have been in Delaware County, so there's some precedent. I don't know if there's been talk about doing that here.
So the question is, has there been any talk of the National Guard coming into any facilities that were in need of staffing? I am not aware at this moment of any facilities that have put in, and the way that process would work is the facility would file an unmet need request with PEMA, the Pennsylvania Emergency Management Agency. We would certainly be able to assist them with the filing of that request, but that's how that would go. I can share with you that there were 2 locations, and I know at least one, if not both of these, have been reported, that because of issues with staffing, closed their Montgomery County site and moved their residents to other sister facilities to deal with a staffing issue. We have not had to have the National Guard come into any Montgomery County facility sites. Todd?
The first question is from Pete Reiner from WNPV. Do the commissioners have any thoughts about the layoffs at Tower Health involving about 1,000 administrative and technical workers? He notes that Pottstown Memorial Medical Center is a Tower Healthcare institution.
Yeah, I actually don't have any information on that. In fact, this is actually the first time I'm hearing about that. I have not spoken to the CEO at Tower in about a week or so. I'm sorry, the CEO at Pottstown. So I'm not sure if any of those layoffs happened at Pottstown or not. I will say, just as a general comment, that many of our hospitals just across the Commonwealth, because they stopped doing all of their elective procedures in order to make room for COVID-19 patients, have seen pretty substantial revenue decreases. And I know there was money in a bill that the Senate passed yesterday in a bipartisan fashion for hospitals specifically for this reason. So I think this is a national problem, which is why you saw federal action on it, but I don't have the specifics in terms of Pottstown Hospital.
Another question from Pete Reiner from WNPV. Just about everyone still working is required to have their temperature taken when reporting for work these days. From a public health point of view, which is better, an oral or temple swipe thermometer?
Well, I'll tell you, the best place to get your temperature is with a rectal thermometer, but since that clearly would not be practical for everybody coming to work every day, the differences between an oral or a facial, like a temple skin thermometer, are so tiny that I think the skin thermometers are just fine, particularly since you have a lot less risk of infection and things like that. So I don't think it really matters. And it's a lot easier to do the touch thermometers on the skin.
Our next question is from Carl Hessler from the Pottstown Mercury. Now that federal regulatory requirements will mean nursing homes must report COVID-19 cases to the federal government, will county health officials play any role in acquiring that information from nursing homes and in publicly identifying the nursing homes that have reported COVID-19 cases?
We will not play any role in the nursing homes reporting their data to CMS. That's between the nursing home and CMS. We are, as I've been reporting, in daily communication or near daily communication with a number of our facilities. We are sending teams out into some of our facilities. We have not yet made a decision about whether we will identify those facilities. Right now, it is a policy of the state Department of Health not to identify those facilities. The state is the licensing agency for those facilities, and so that's where we're at this moment.
The next question is again from Carl Hessler from the Pottstown Mercury. We're receiving reports that the county is calling workers in to assemble voting machines at the county warehouse in preparation for the June primary election. If that is so, how many workers are being called up, and can you ensure that social distancing measures can be maintained while workers perform those duties?
Commissioner Lawrence is chair of our election board, so I'm going to let him take that one.
We will have 24 workers working on Saturday to begin assembling 350 voter scanners that we need for the election. They will be at our voters' warehouse. Their health and safety is paramount to us. They will be provided masks and gloves. Their temperatures will be taken, not rectally. But Yeah, it's a 25,000-foot square warehouse. It will be socially distant. We will have management there. We need to prepare for the election on June 2nd. We will make sure that our employees, their health and safety comes first.
The next question is from Jim Melwork from KYW. Is there a temporary morgue set up in Upper Marion? Does that mean the county morgue is full? And if so, how many bodies are currently in the temporary morgue?
There is a surge morgue facility set up in the county, and that is all the information that I have.
The second part of that question from Jim Melwork is, how is this facility being used, and is it for Montgomery County specifically or for the region?
Our surge morgue capacity is a regional asset, and it can be accessed by any hospital or other facility that is in a situation where maybe the funeral home director isn't able to receive that individual at this particular moment. And so we can provide surge capacity if needed, if the hospital or other facility is not able to appropriately maintain the deceased.
The final question is from Jim Melwork from KYW. Do you worry that reporting probable deaths might lead the people who are already saying the numbers are inflated to be more skeptical, about the numbers?
So that's a very good question, and that is one of the reasons why I've asked our team to keep two separate lists, because I do think it's really important to report the data that we're 100% certain of, which means that there's been a positive test for COVID-19 in that individual. So we will continue to report the confirmed positives, but we will also report the probables. And all I can do is come here every day and share with you the factual information that I have, that I receive. And I hope that the public understands that we're just trying to give them as much information as we can, and that we're not trying to hide anything. We're trying to be as transparent as possible. I don't know what else to say about probable deaths other than whoever filled out the death certificate felt that the clinical situation was consistent with COVID-19. Doctors do that all the time. We don't always know for sure what the cause of death is, and so we use our education and our training to make an educated decision about what that cause of death was. But I won't tell anybody that those deaths were proven, because they weren't. So that's really what we're going to have to deal with going forward. Anything else? Okay. We'll see you all tomorrow. Thank you.